lack of swaddling. From Egyptian times, 3,000–4,000 years ago, we can find that they use swaddling. We can also find swaddling, for example, in Christian religion. It is a famous saying that baby Jesus in swaddling clothes. On Renaissance paintings, we can see swaddled babies. The same we can say about medieval England, where different swaddling cloths were used for people who were rich and who were poor. And these babies also had caps, bonnets, so that to keep their mouth closed. Now, during more recent times, these traditions started to disappear. There are fewer and fewer babies who are swaddled in hospitals. Let us look what Dr. Buteyko wrote about swaddling. But the cells of animals and humans need about 7% CO2 and only 2% O2 in the surrounding environment. This is the way our cells live, cells of the heart, brain and kidneys. But now air has 10 times more oxygen and 250 less carbon dioxide. It is not suitable for our cells and it is poisonous in its composition. This is confirmed by embryology. During recent years, detailed studies of gas-blood exchange in embryos of humans and animals were done. It was found that during those 9 months we live in an environment which has 3–4 times less oxygen and 1.5 times more CO2, both as partial pressures, in comparison with adults. Obviously, the organism of the mother creates such conditions for the embryo as they were billions of years ago. This supports the law of Haeckel-Severtsev. The embryon, in its development, repeats the phylogenesis. After birth, during the first breath, there is a sudden increase in blood oxygenation and a sudden drop in CO2. It is known that the child is virtually disease-free in the womb of the mother. Only after the birth, diathesis and all other abnormalities of metabolism appear. Why? There is a sudden change in air. The wisdom of East surprises us. The just-born infant is tightly swaddled and in some places even tightened to a wooden plate. The chest is covered by layers of heavy material. Our grandmothers covered the cradle with the infant using material covering, leaving a small hole for air exchange, and we used swaddling too. Folk wisdom understood that this air, so poisonous to the newborn, requires gradual adaptation. Dr. Buteyko, public lecture in the Moscow State University on 9 December 1969. If baby is swaddled, the baby would sleep peacefully. You would see a smile on the face. It would be quiet. The digestion would be good. Now, if baby is not swaddled, the baby is going to cry. You would see loud noises, and we can also think about evolutionary viewpoint. That probably in the past, baby must be swaddled, because otherwise crying would attract animals who could eat the baby. So swaddling probably was a very important part of our cultural tradition from all over the world. In fact, I asked many people from different countries, and I found that just 100 years ago it was the norm virtually everywhere. For example, in Scotland we passed swaddling blankets from generation to generation. In Australia, Africa, United States, other countries, when I ask all the people, they say that swaddling was the norm. Now what is going on with babies? Less and less of them are swaddled in hospitals. And what it does to them? Let us look at some results from medical science which were discovered maybe just 10–15 years ago. We have an abnormal epidemic of cases when babies who are just 2, 3, 4 years old develop such serious conditions as cancer, heart disease, severe obesity. There was recently a case of a baby who was 4 months old already on steroids for asthma. Why does it take place? If baby is not swaddled, the breath holding time of such a baby would be about 5, 6, 7 seconds. Breathing would be much heavier than it should be. A swaddled baby would have breath holding time much higher, breathing would be lighter, easier, and all these health abnormalities would not be possible. As you remember, 2 times we already discussed the importance of nasal breathing during physical activity and for babies as well. Now, mouth breathing would be a very destructive factor for our health. Why? How does it work? How does it affect our health? When we breathe through the nose, our nasal passages are long and narrow. We are able to tolerate high CO2 concentration in our lungs. Now when we breathe through the mouth, route of communication is wide and short. Even if we breathe less air, we lose more CO2. And all our body starts to suffer from hyperventilation. In fact, if I see a person who is breathing through the mouth, it is clear for me, my practical experience show, and experience of other doctors, that breath holding time of this person would be 25, maybe even less seconds. The breathing is already heavy. This is a parameter, a factor of hyperventilation. There is also another effect which relates to mouth and nasal breathing. I'm talking about nitric oxide. It's produced in various parts of the body, but it is also produced in sinuses, so that during each inhalation we can take it inside our lungs and it can travel in our blood. Why it is important? Nitric oxide also dilates blood vessels. What it also does, it participates in the transmission of nervous signals. It modulates the immune system. We need nitric oxide. Now, think about heart patients. Many of them breathe through the mouth. And there is one popular drug, which is called nitroglycerin. It appeared long time ago. During First World War, it was noticed by medical doctors that those people who worked with explosives, they had low blood pressure. Later they started to investigate and found that breathing nitroglycerin reduced blood pressure. So drug appeared based on nitroglycerin. But it was recently discovered, just about 15-20 years ago, that nitroglycerin is converted to nitric oxide. And what happens when patients with heart problems put nitroglycerin in their mouth, nitroglycerin produces nitric oxide that helps them to have lower blood pressure. They can avoid heart attacks. But if these patients, imagine, instead of taking nitroglycerin and breathing through the mouth, just close their mouth, they would be able to utilize their own nitroglycerin. And hence, they would need less medication. And in fact, it is absolutely right. When I have my patients, when Dr. Buteik and his colleagues have their patients, they found that keeping mouth closed is exceptionally important. And in most cases, it helps people to reduce medication about 2 times. So the next cause of hyperventilation would be mouth breathing. As you may remember, when we were discussing quality of life and particularly quality of sleep, we mentioned different hours which are often typical for people with various breath holding times and with various breathing patterns. So we know that in the past our sleeping time was very short, 5, 3, 4, maybe just 2 hours. But now we sleep longer. And in fact, it is known from another section, morning hyperventilation, that long sleep produced severe problems in people. At certain moment of time, 3 o'clock in the morning, usually sometimes 4, 5, breathing gets much heavier, maybe 2, 3 times heavier. And patients can die from asthma attacks, heart attacks due to heavy breathing. So sleeping too long would be a factor which did not exist in the past. So we can write one of the causes of hyperventilation would be sleeping too long.